Well, welcome everyone. Thank you for taking time out of your day to join us today. My name is Jody Brockman. I'm an RN here at NKC Health in the Community Health and Wellness Department. And I'm so happy to have my good friend Denise Sharp, nurse practitioner, join us today to talk to us a little bit about palliative care. And I am going to let you take it from there, Miss Denise.
Well, welcome everyone, and I appreciate your time and support. And one of the reasons we're doing this talk in November is because it is Hospice and Palliative Care Month. So I just wanted to share some information, maybe give you new information about palliative care. I have no disclosures and no financial interest in presenting this lecture. So we're going to talk a little bit about what palliative care is. Palliative care is a philosophy. It's a type of medical care for people living with a serious or life-limiting illness. When a serious illness presents, it bombards the patient and the family. The demands of illness, medical appointments, treatment regimens, and difficult decisions are to be made, and this also is surrounded with a degree of uncertainty. It takes into account not just the physical suffering, but also the mental, emotional, and psychological and spiritual suffering of the patient and family and caregivers. Palliative care should be looked at more as an extra layer of support. So we're not taking anything away, we are just adding to the care. What is palliative care? Palliative care does not mean that a person is giving up. It means that you're receiving care in a variety of settings. The goal is to meet the patients where they are. So that means if they're at home, if they're in the hospital, if they're in a nursing home, palliative care can be provided in all of those scenarios. The goals of palliative care are to manage symptoms such as relieving pain, nausea, fatigue, and other distressing symptoms. It provides emotional and spiritual support, addressing anxiety, depression, and other existential concerns. Another big part of palliative care is coordinating care. So you're going to work with multiple healthcare providers, such as primary care, oncologist, cardiologist, whatever specialty is needed, as well as get help with social work. And also, palliative care is to improve patient and family well-being. You want to enhance communication, respect patient preferences, and provide support for caregivers. So, like we said, the goal of palliative care is to alleviate suffering and improve quality of life among people with serious illness. So we're not taking anything away. We work along with other existing medical teams to enhance care by focusing on living the best life for as long as possible. Also, the goals of palliative care tend to be physical, functional, psychological, practical, and the spiritual consequences of a serious illness. We address all of those. Palliative care focuses on the assessment and management of pain and other symptoms, the assessment, supportive caregiver needs, and other coordination of care. The one thing that you will see that is missing from palliative care is dying. Our goal is to enhance life, and it does not include dying because it should be about how a person lives and their quality of life. People on palliative care can also receive palliative care for as long as needed. There is no timeline. As long as you have a serious illness and needs, that qualifies for palliative care. Eligibility, it's available to all people of any age who need it, not just older adults. So even children can get palliative care. The major elements of palliative care include managing a person's symptoms effectively and ensuring that their care is coordinated. It is an interdisciplinary specialty, which means that it involves multiple types of doctors, like we said before, and other care providers. These providers work together with patients and their families and care partners to ensure that the treatment plan reflects the person's goals and values. Palliative care can start as early as the person's diagnosis, or it can start later in their illness, and it can occur alongside other types of treatment for the disease. So when is palliative care appropriate? That's a big question that a lot of people ask. And the things that we look for are frequent admissions. Are people being admitted to the hospital several times over months for the same reason? Multiple hospitalizations over a short time period is definitely a key marker. Complex home needs, if symptoms are at home or difficult to manage, or if there are other psychological needs such as depression, anxiety, uncertainty, that can all be helped. Surprise. Would you be surprised if the person died within the year? If that is the case, then they are definitely eligible for palliative care. Failure to thrive. This occurs when a person just stops gaining weight. They're not able to do the things they used to do. They can't carry on the daily rigors of life or do the daily activities of living, such as getting dressed, feeding themselves, personal hygiene. When those things become difficult, that's when palliative care can step in. Advanced care needs. Palliative care also helps with decision making, such as advanced care planning, DNRs, durable, not durable, but advanced care directive planning. And also, if there's limited social support at home, that's where palliative care can step in with our social workers. Common diagnoses that you might see in palliative care include cancer, cardiac disease such as congestive heart failure, COPD, kidney failure, Parkinson's disease, dementia, and many, many others. Palliative care aims to limit unwanted, unnecessary, and painful treatments and interventions. The goal is to improve response to treatments. So we want to increase the person's ability and the family's ability to cope and care for their loved one. Increased satisfaction of care also comes with palliative care because you are getting that extra layer of support. People will come in teams and come to terms with a difficult situation. Palliative care is appropriate at any age, at any stage of any serious illness, and you can also receive curative treatment along with palliative care, such as chemotherapy, dialysis, and radiation. What are the benefits of palliative care? One is extended life expectancy. Some studies have shown that palliative care can improve survival rates in some cases. By managing symptoms and improving quality of life, palliative care can enable patients to live longer and more comfortably. It is true that people who have life-limiting conditions or illnesses that will lead to the end of their life receive palliative care and transition to hospice when it's needed. However, it's also true that some people with acute periods of illness recover, are cured, or achieve optimized management and no longer need palliative care services after some time, so it's not always forever. Supporting caregivers, palliative care, we also provide education and resources for caregivers. We assist in the practical tasks of decision making and offering emotional support and respite. So, for example, if you're caring for a loved one at home and you need time to get away, go to the store, run errands, you can have volunteers come in and help care for the patient or your loved one while you're out doing that. So there are a lot of benefits that possibly hospice does not cover. Other benefits of palliative care: reduced hospitalizations and emergency room visits. improve patient satisfaction, and lower healthcare costs. Because you will have doctors and you'll have nurse practitioners and you'll have nurses and therapists and social workers all in the place where the patient is receiving care to help with those things so that you can avoid going to the ER multiple times or having to go to doctor's appointments. So we try to do everything where the patient is. Financial concerns. Palliative care is covered by most private insurance plans and HMOs. They do all cover palliative services. Some treatments and medications may not be covered under individual plans, so it is important that you check with your insurance provider. Medicare Part B and Medicaid also pay for some palliative care depending on the treatment. And this is different than hospice. Hospice is a Medicare covered benefit at 100%. So 4 questions to ask when you're thinking about receiving palliative care. You want to ask the company or the agency, what will you do that is different from the care I'm receiving from my current physicians? How will you coordinate with my doctors? Because you want to make sure that everyone is communicating and everyone is on the same page. Will my insurance cover all services? So we did talk about that. So it is important that you contact your insurance carrier and ask all questions. And you also want to ask, will my loved ones be involved? And that is very important because we're not just there for the patient, we're also there for the caregivers and the loved ones. This is more of a holistic approach where we're looking at everybody and the quality of life for everyone. So we are taking everyone into account. Palliative care is a philosophy and type of medical care for people with serious illnesses. This care is focused on providing relief from symptoms and stress of a serious illness. The goal is to increase quality of life for the patient and family and not just take into account physical suffering, but also the mental, emotional, and spiritual suffering. Who provides care on the team? Kind of like we talked about, there will be physicians, nurse practitioners, nurses, social workers, and chaplains. Some agencies also, like I have mentioned, have volunteers that will come and sit with patients, read to patients, do activities with patients, take them out, let them do something that they enjoy doing. So we all collaborate together to provide that support and care. Services offered with palliative care, as you can see, I've mentioned symptom management, medications, therapies, nursing, and nutrition support. So, symptom management, like I've discussed, your palliative care team will assess how much pain a person is in, how much fatigue they have, if they're having other symptoms like shortness of breath, swelling, nausea, anything that would be affecting the patient, we're going to look at and see if we can improve. Palliative care also provides medications. We can prescribe and manage medications for symptom relief. Therapies, you may get physical therapy, occupational therapy, speech therapy. You could also have relaxation therapy. There are many, many therapies that are available with palliative care. It is endless. Skilled nursing, you'll have a nurse that would come see you on a frequent basis just to check wounds, do a full assessment, check your medications, see how the patient is doing, if any changes need to be made, and then they coordinate that with the nurse practitioner or physician. Nutritional support is also very important. You'll get guidance from a nutritionist, diabetic educator, and how to manage appetite loss. So palliative care includes a wide range of services focused on improving quality of life by managing symptoms, stress, and other difficulties associated with serious illnesses. These services are provided by an interdisciplinary team and can include medical and therapeutic interventions, emotional and spiritual support, and help with practical matters. Palliative care services by emotional and spiritual support. You can receive counseling to go through the emotional and psychological support for both the patient and the family. It helps to manage stress, anxiety, and depression, which in turn will improve quality of life and healthcare. Also, you can get spiritual guidance with spiritual counseling and support through chaplains and other spiritual advisors. Care coordination and practical support services. Care coordination, we work with the patient and the patient's primary doctors to ensure a coordinated care plan. We also advocate for the patient by helping to ensure that patient's wishes are heard, their needs are addressed within the healthcare system. We also provide education and decision-making support. We help patients and families understand their medical options and how to make informed decisions. Community resources are also available that helps you connect families with community resources like Meals on Wheels or transportation services. And also, like I've mentioned, advanced care planning, assisting with the creation of an advanced care plan or advanced directive if needed. Caregiver roles. A caregiver in palliative care provides emotional and physical support, manages the day-to-day tasks, and acts as a liaison with the healthcare team to improve a patient's quality of life. The role includes practical help like assisting with personal care, preparing meals, managing medications, also while providing companionship and comfort. Caregivers are a crucial link to medical providers, communicating new information that can help improve a patient's treatment plan. So caregivers do a lot of things, and we also want to make sure they are supported. We assist with personal needs. You may have a home health aide helping with bathing, hygiene, and other personal care, meal preparation, mobility and activity. We can aid with physical movement. We can teach caregivers how to correctly move patients so they don't get injured. We can do household management. We can help with groceries, shopping, financial matters, resources for paying bills if that is an issue. Medication management, we monitor, manage, and administer medications. We also teach caregivers how to do that and how to give medications as directed. And we also offer environmental support, ensuring that the patient's environment is comfortable, like adjusting room temperature. We can do music therapy. We can provide reading material. So there's an endless array of activities and benefits to palliative care. Also, with caregiver roles, emotional and social support, companionship, emotional support by offering comfort. We can be a listening ear. And then advocacy, we always want to advocate for the patient and the caregivers. Palliative care specialists provide caregivers with methods to better assist their loved ones. For example, knowing how to help bathe or dress your loved one without causing physical pain can be important. So we're going to teach that. Palliative care specialists take the time to listen to patients and help them focus on things that they can control, like creating and reaching small goals or returning to the things that bring them joy. For a caregiver, the same support can be beneficial. Palliative care specialists know if a caregiver is not being treated for their issues, it can affect the patient's well being. And that's why they make caregiver stress a serious focus in their care. They will work with you to answer your questions, hear your frustrations, and help you take the necessary steps to feeling healthier and more focused in your role. Caregivers play a key role in supporting patients in palliative care and enabling dying at home. Several studies show that caregiver role is demanding and may have negative effects on health and well-being. Caregivers have a dual role as coworkers and co-clients and may have support needs in both dimensions. Caregivers in palliative care frequently report unmet social needs, particularly highlighting neglect of their psychosocial and emotional well-being. So we want to make sure that everyone is being taken care of. This chart shows you some caregiver support where they show that they need the most support, having time for yourself throughout the day, all the way down to your own spiritual and cultural concerns. So there is a lot of work to do with caregiving, and we want to make sure that we address that. Also, with caregiver support, you're the communication hub. Caregivers inform the healthcare providers about changes that they're seeing in the patient's condition, whether they're improving or not. If they're not improving, then that allows us to talk about other goals and treatments. Coordination, they help to coordinate appointments and other necessary tasks. And caregivers also help with personal well being, seeking and accepting help from other family, friends, or other palliative care team members to avoid burnout. Common misconceptions of palliative care: palliative care or comfort hastens death. Palliative care is only for people who are dying. Palliative care is the same as hospice. Like we said, palliative care is not giving up, and palliative care, like I just said, is not hospice. The focus is to improve quality of life for the time the person has left. Several studies have demonstrated no hastening of death with palliative care. Some studies have also demonstrated a longer life expectancy in patients who receive palliative care. There are cultural differences, and these cultural differences carry beliefs about speaking about death, dying, or illness. Some cultural beliefs believe that speaking of death and illness can worsen a patient's condition, so it's important to inquire about beliefs, fears, and superstitions. Palliative care is not the same as hospice. People in hospice can receive palliative care, but you can receive palliative care long before receiving hospice care. Communication is important and potentially can be difficult with these situations, but communication is frequently necessary with palliative care patients who have active, progressive, or far advanced diseases. Um, Palliative care works with communication on breaking bad news, giving further treatment directives, teaching family and caregivers about the disease, communicating prognoses, allowing and educating admission into a palliative care program. We communicate about artificial nutrition, artificial hydration. We can give medications such as antibiotics, and we also communicate about do not resuscitate orders. Good communications lie at the heart of palliative care in every palliative care service. Its importance of the importance of communication cannot be exaggerated. Many new palliative care services are judged as much by the quality of communication as by their clinical care. So it's not only patients and relatives with whom palliative care workers must communicate. They must be skilled in explaining to the public what palliative care is, how it is practiced, and this time when so many misunderstandings surround it, providers must be able to explain what palliative care is, not either that it is not euthanasia or it is not physician assisted suicide. These communication skills will depend much on the success and effectiveness of the service and how much it is supported and valued. Questions to consider when making a decision. You want to ask yourself, what is your understanding of the state of the disease and the prognosis? What do you understand about the disease? What do you understand is going to happen? Do you understand the goal of the treatments that are discussed? Do you understand if they're palliative treatments, if they're not curative treatments, if we're just trying to manage symptoms, or if we are reaching for a cure? Do you understand the potential benefits and burdens of the treatment options? What are your expectations? What are you hoping for? What do you think what are your preferences? What are the patient's preferences? What are other family member preferences? And we also need to consider, what is DNR status? Do you want to be a do not resuscitate? Do you still want to be a full code? Those are all questions that we need to ask. Some of those are very hard questions, but you want to ask the hard questions when the time is not as stressful, when things are really bad and the prognosis is poor and there's a lot of stress. That is not the time to be asking these questions. You want to have a plan in place well before that. And then to discuss the difference between palliative care and hospice. Hospice care is an insurance benefit through Medicare. It is paid for 100%. It focuses specifically on care, comfort, and quality of life of a person with a serious illness who is approaching their end of life. So palliative care can go on for many, many years. It doesn't mean end of life. Hospice is more for the end of life. The key difference is the patient and families receive hospice care. They tend to realize that their illness is not responding to medical treatment as hoped. The patient and doctors believe with hospice, the person will have 6 months or less to live, or it will be 6 months before the disease runs its natural course. For this reason, patients and families may wish to forego additional treatment and rather focus on priorities. Hospice provides support in the home, hospital, hospice house, or nursing facility. Support includes symptom management, pain management, spiritual and emotional support for patients and families. If you are looking for a palliative care agency and you're not sure how to do so, if you go to medicare.gov Care Compare website, that will give you ratings of agencies. It will give you a breakdown of how they're doing, their quality measures. It will also give them a star rating. I would recommend that site first. It provides quality measures by checking with state organizations such as the National Hospice and Palliative Care Organization. You can also ask your physician for recommendations. Many physicians work with certain agencies, and you can also call agencies directly and inquire about quality scores. And you also want to look for agencies that have accreditation from organizations such as the Joint Commission or the Community Health Accreditation Partner. And that concludes this presentation. Are there any questions?
I have a question for you, Denise.
Yes, ma'am.
You mentioned that kind of like with hospice, I know that they have certain qualifications that they have to meet guidelines, and sometimes you can be in hospice, and then they say, you know what, we don't feel like you're really meeting all the guidelines right now. So they get discharged from hospice. But with palliative care, so once they're enrolled, they don't have to meet any kind of guidelines.
They just have to have a serious illness.
Okay, that's
and
awesome.
symptoms. And they can remain on palliative care for years.
I like the fact that they'll be able to get help with different resources, because there are so many resources out there.
And everybody needs help with so many different things.
They change so often. I think that is wonderful. And then also, I had no idea that you could go to this Medicare.gov for palliative care. I knew you could for like home health and for hospice, but
you can for hospitals, palliative care, hospice agencies, home health, almost anything healthcare related.
That's great. That's great. So can you travel on palliative care?
Yes, you can.
Okay. That was a great question from one of our attendees.
Yes, because that is something that we want people to do. We want people to still do what they love to do. So we will make it happen.
That sounds great. Because I know sometimes the doctors aren't up on all the new things with palliative care. So I
Yes.
think this was very helpful.
Good.
And a refresher too.
And I hope that more doctors will use it.
Yeah.
Because it is a needed specialty. Or just an extra layer of support or additional eyes. We can report back to physicians what we're seeing. They can manage the care without having the patient go back into the hospital. And it's just a great benefit.
Yeah, it is, definitely. Well, for everyone who has joined us today, maybe no palliative care at St. Luke's. Okay. So again,
some hospices are getting away from palliative care. It's not as common as it used to be, but I do know there are some agencies in Kansas City that do offer it.
So I think that's probably where the Medicare.gov website comes into play if you're looking for a palliative care option. So thank you for letting us know that, Jim.
Appreciate it. Palliative care can also be started in the hospital if needed.
Yeah, and there is a complete group of palliative care in the hospital, right?
Okay. Some hospitals, for example, KU, has their own palliative care team.
And I think NKC Health, I'm pretty sure we do here as well. That's wonderful. Well, thank you for all of our participants today. We have recorded this. We will post it on our YouTube page, and you can share that link with anyone that you feel might benefit from this information that Denise gave us today. And there are also just many other great offerings that we have that live out there on our YouTube page. It's just incredible. All the wonderful community resources we have, all the wonderful specialists that we have working here at the hospital that give their time to present for us. We're just very grateful to them. And I will email all of you who signed up today, again, with the link to this YouTube post. And also Denise has graciously offered her contact information. If any questions do arise in the future, she said feel free to reach out to her.
I will add that.
Yeah, thank you so much, Denise.
You're very welcome. With my experience with hospice and palliative care spanning several years, I will be happy to help in any way possible.
Okay, perfect. Let's see here. We might have another question. Yeah. Thank you.
Well, thank you all for your time.
Yes, and everybody have a great day and enjoy this wonderful weather while we have it.